My name is Lucia Ayeila. I am at Aga Khan Hospital today for an open myomectomy to remove my fibroids. I've had fibroids for I think 15 years of my life. I just did not know because we assumed period cramps were normal. And then in 2020 was the first time that I confirmed that I did have fibroids. And my doctor at that time said that they were too small to be removed. But then as the years have progressed, I think they've grown and the pain has just become unbearable. So I am looking forward to just having them removed and having somewhat of a normal life. I am feeling a bit anxious this morning. It's my first time undergoing surgery. It's my first time being admitted in hospital, the major health challenge that I've ever had in my life. So I think some little anxiety will be normal. But the team here is so nice and so kind, so I'm feeling comfortable. And I have a support system around me that consists of the Aga Khan University Hospital, so it shall be well. Hi guys, so this is me post-surgery and on my recovery journey. I am here today to have a conversation with you about my treatment journey, recovery, and to shed some light also on fibroids in general. What are fibroids and how do fibroids present?
Fibroids are non-cancerous growths. We call them benign growths that grow within the womb, that is the uterus. And they mainly affect women of reproductive age. So we're looking at women between the age of 15 and 49 years. They can grow anywhere within the uterus. They can be on the outside, they can be within the wall or on the inside. And based on where they are located and the size and the number, they can make the lady to have various complaints. And it's most of these complaints that bring them to us.
Is there any known cause of fibroids so far?
There is no known cause, but we have factors that generally make somebody more likely to have fibroids than others. And some of these include the black race. And why we say the black race is because you find women of black descent tend to have fibroids discovered at a much earlier age than those of the white descent. Their fibroids tend to be a lot bigger, they tend to be more in number, and even those who come to hospital for fibroid-related complaints are a lot more. And as such, a lot more black women undergo interventions to treat fibroids than non-blacks. The other one, of course, is if you've had close family members having fibroids. That means you're possibly sharing the gene for fibroids. But the main risk factor is being black, and we say the lifetime risk of a black lady is about 80 to 90% of having fibroids. So that simply means by the time you're getting to 50, 9 out of 10 will have fibroids.
So the main risk factor is just being a black woman?
Yes, a black race is the main recognized risk factor. The others we tend to call them more of associations. The other one I could just think off my head is age, because as we've said, lifetime risk is 90%. So typically as you're getting older, it means the chance of you having fibroids increases. So there is a chance that if you're checked at 25, you'll not have fibroids. But if you're checked at 45, you have fibroids. It's because they've had enough time to grow.
So for someone who's watching us and they're thinking they can't afford surgery and they have fibroids and maybe they're causing them some pain or a disruption to their life, what are the palliative care measures that they can take at home? Like what can they do to just manage?
The first thing they can do what you did, but of course that may not succeed. But yeah. Management of fibroids is categorized into just doing nothing, just what we call watchful waiting. We can also do medications, and lastly we can do surgery. Now, for watchful waiting are those that don't have symptoms. Yeah, if we found the fibroids as you are doing other things, you don't need to disturb it. But if you're having symptoms of pain, you can use painkillers. If you're having symptoms of heavy bleeding, there's some medications you can use to reduce the heavy bleeding. Maybe they're too big and you feel you want to get yourself ready, try to look for cash. There's a medication and injection you can be given to cause the fibroids to shrink a bit. So those are the medical options that are available.
I'm still recovering, but I'm back on track. I'm able to do a majority of things that anyone else will do. I cook, I clean, I go to work, I come back. So now it's just to get back to my normal life, and hopefully I don't get any other complications other than this, and I hope sipewi madawa ama sidungwi shindano, because I am over it. So hope to meet you guys out there doing different things and just back to normal life, and may the doctors here and the entire team continue doing the great job that they're doing. Thank you.